so in this presentation, we will go over and explain your Medicare coverage choices, original Medicare Part A and Part B, including assignment and private contracts, Medicare supplement insurance or Medigap policies, Medicare prescription drug coverage Part D, Medicare Advantage plans Part C, and other Medicare health plans. There are two main ways to get your Medicare coverage. It's original Medicare or through a Medicare Advantage plan. Again, original Medicare or Medicare Advantage plan, and we'll explain that. Original Medicare includes Part A, hospital insurance, and Part B, medical insurance. You can choose to buy a Medigap policy with this choice. You must have Part A and Part B to help cover some costs not covered by original Medicare. You can also choose to buy Medicare prescription drug coverage Part D from a Medicare prescription drug plan. To buy a prescription drug plan, you can have Part A only, Part B only, or both. So let's go over this option. Medicare Advantage plans, also called Part C, like a health maintenance organization, HMO, or a preferred provider organization, PPO. So it can be either or. They cover Part A and Part B services and supplies. They also may include Medicare prescription drug coverage, MAPD also called. You can add Part D plan to a Medicare cost, private fee-for-service, or Medicare medical savings account, MSA plan that doesn't have prescription drug coverage included. You can't add Part D coverage to an HMO or PPO plan without drug coverage. So that's very important to remember. Medigap policies don't work with these plans. If you join a Medicare Advantage plan, you cannot use your Medicare supplement insurance or Medigap policy to pay for out-of-pocket costs you have in the Medicare Advantage plan. So it's either one or the other. Okay, so let's move on. Original Medicare is one of the coverage choices in the Medicare program. You'll be in the original Medicare unless you choose to join a Medicare Advantage plan or other Medicare health plan. Original Medicare is a fee-for-service program that's managed by the federal program. With Original Medicare, you can go to any doctor, supplier, hospital, or facility that accepts Medicare and is accepting new Medicare patients. If you have Medicare Part A, you'll get all medically necessary Part A covered services. If you have Medicare Part B, you get all medically necessary Part B covered services. As we mentioned earlier, Part A is premium free for most people. For Medicare Part B, you pay a monthly premium. The standard Medicare Part B monthly premium for those not held harmless in 2017 is $134. In Original Medicare, you also pay deductibles, coinsurance, or co-payments. After you receive healthcare services, you'll get a notice in the mail called a Medicare Summary Notice that lists the services you received, what was charged, what Medicare paid, and how much you may be billed. If you disagree with the information on the Medicare Summary Notice or with any bill you receive, you can file an appeal. There's information on the Medicare Summary Notice about how to ask for an appeal. If you are in Original Medicare, you can also join a Medicare Prescription Drug Plan or Part D to add drug coverage. Okay, so let's talk about assignment. Assignment means that your doctor, provider, or supplier agrees or is required by law to accept the Medicare approved amount as full payment for covered services. Most doctors, providers, and suppliers accept assignment, but you should always check to make sure. Participating providers have signed an agreement to accept assignment for all Medicare covered services. Here's what happens if your doctor, provider, or supplier accepts assignment. Basically, your out-of-pocket costs may be less. They agree to charge you only the Medicare deductible and coinsurance amount, and usually wait for Medicare to pay its share before asking you to pay your share. Okay? and they have to submit your claim directly to Medicare and cannot charge you for submitting the claim. In some cases, doctors, providers, and suppliers must accept assignment, like when they have a participation agreement with Medicare and give you Medicare covered services. In case your doctor does not participate in the assignment, non-participating providers haven't signed an agreement to accept assignment for all Medicare covered services, but they can still choose to accept assignment for individual services. So if your doctor, provider, or supplier doesn't accept assignment, you might have to pay the entire charge at the time of service. Your doctor, provider, or supplier is supposed to submit a claim to Medicare for any Medicare covered services they provide to you. They can charge you for submitting a claim. So if they don't submit a Medicare claim once you ask them to do, you can call 1-800-Medicare. They can charge you more than the Medicare approved amount, but there's still a limit called the limiting charge or excess charge. The provider can only charge you up to 15% over the amount that non-participating providers are paid. Non-participating providers are paid 95% of the fee schedule amount. The limiting charge applies only to certain Medicare covered services and doesn't apply to some supplies and durable medical equipment. A private contract is an agreement between you and a doctor who has decided not to furnish services through the Medicare program. The private contract only applies to services given by the doctor who asked you to sign it. This means that Medicare and Medicare supplement insurance, Medigap policies, won't pay for the services you get from the doctor with whom you have a private contract. You can't be asked to sign a private contract in an emergency or for urgently needed care. You still have the right to see other Medicare doctors for services. If you sign a private contract with your doctor, then no Medicare payments will be made for the services you get from the doctor. Your Medigap policy, if you have one, won't pay anything for the service. You'll have to pay whatever the doctor or provider charges you. Again, Medicare limiting charges. Well, basically in this case, Medicare limiting charges won't apply. Other Medicare plans won't pay for the services. No claim should be submitted, and Medicare won't pay if one is submitted. Many other insurance plans won't pay for the service either. The doctor can't bill Medicare for 2 years for any services provided to anyone with Medicare. Okay, so we have to be very careful on that. A Medicare supplement insurance policy, often called Medigap, is private health insurance that's designed to supplement original Medicare. This means that it helps pay some of the healthcare costs that the original Medicare doesn't cover, like co-payments, co-insurance, and deductibles, depending on the plan. These are gaps in Medicare coverage. If you have original Medicare and a Medigap policy, Medicare will pay its share of the Medicare approved amounts for covered healthcare costs, then your Medigap policy pays its share. You must have both Medicare Part A and Part B to get a Medigap policy. You pay the private insurance company a monthly premium for your Medigap policy in addition to your monthly Part B premium. Medigap policies cover only one person. If you and your spouse both want Medigap coverage, you'll need to have separate Medigap policies. Okay, let's see, I can move on to more details about Medigap plans. So in most states, Medigap insurance companies can only sell you a standardized Medigap policy identified by letters A, B, C, D, E, F, G, K, L, M, and N plans. Part D and G will, with an effective date on or after June 1st, 2010, have different benefits than plans D and G bought before June 1st, 2010. Plans E, H, and I, and J are no longer sold, but if you already have one, you can generally keep it. Plan F has a high deductible option as well. Each standardized Medigap plan must offer the same basic benefits, no matter which insurance company sells it. The benefits in any Medicare plan identified with the same letter are the same, regardless of which insurance company you purchase your policy from. Cost is usually the only difference between Medigap policies with the same letter sold by different insurance companies. So that's why you are encouraged to shop carefully for a Medigap policy. Insurance companies selling Medigap policies are required to make Plan A available. If they offer any other Medigap plan, they must also offer either Medigap Plan C or Plan F. Not all types of Medigap policies may be available in your state. Some people may still have a Medigap policy they purchased before the plans were standardized. If they do, they can keep these plans. If they drop them, they may not be able to get back those plans. Medigap policies are standardized in a different way in Massachusetts, Minnesota, and Wisconsin. These are called waiver states. So you pay a monthly premium for a Medigap policy to the insurance company that sells it. With a Medigap policy, cost can vary by plan, company, your age, and location. Right? They must follow federal and state laws that protect people with Medicare. Your Medigap policy, your Medigap open enrollment period starts when you are both 65 and signed up for Part B. Once it has started, it can be delayed or repeated. During your Medigap open enrollment period, an insurance company cannot use medical underwriting, refuse to sell any Medigap policies it offers, charge you more for a Medigap policy than they charge someone with no health problems, make you wait for coverage to start, except in certain pre-existing circumstances. You can buy Medigap policy anytime a company will sell you one. Medigap policies don't work with Medicare Advantage plans. Medigap policies pay for Medicare covered services provided by any doctor, hospital, or provider that accepts Medicare. The exception is Medicare Select policies that require you to use hospital and in some cases specific doctors to get full benefits. I just want to make a note that medical underwriting is a process that insurance companies use to decide based on your medical history whether to accept your application for insurance, whether to add a waiting period for pre-existing condition, and how much to charge for you. Okay. Employer. If you have group health coverage through an employer or union because either you or your spouse is currently actively working, you may want to wait to enroll in Medicare Part B because benefits based on current employment often provide coverage similar to Part B. You would be paying for Part B before you need it. Your Medigap open enrollment period might expire before a Medigap policy would be useful. When an employer coverage ends, you'll get a chance to enroll in Part B without late enrollment penalty, which means your Medigap open enrollment period will start when you're ready to take advantage of it. If you enroll in Part B while you still have current employer coverage, your Medigap open enrollment period will start, and unless you buy a Medigap policy before you need it, you'll miss your open enrollment period entirely. If you or your spouse is still working and you have coverage through an employer, contact your employer or union benefits administrator to find out how your insurance works with Medicare. If you aren't going to enroll in Part B due to your current employment, it's important that you tell Social Security that you want to delay Part B. Just want to make sure that you understand that if you took Part B while you had employer coverage, you don't get another Medigap open enrollment period when your employer coverage ends. You must have both Medicare Part A and Medicare Part B to buy a Medigap policy. Okay, let's move on.